We'll first hear from Elise Marazzo, who's Director of the Maternal and Child Health Bureau at the Maryland Department of Health and Mental Hygiene, and Katie Batani, who leads Maryland's Perinatal and Infant Oral Health Quality Improvement Program. And they're going to be sharing how they're partnering to improve oral health care utilization in Maryland. Elise and Katie?
Thank you. So good afternoon, everyone, and thank you for joining us. We're doing our own slides. Sorry. So thank you, everyone, for having us speak this afternoon. We greatly appreciate it. The relationship with Title V and the Maternal and Child Health Block Grant and the Office of Oral Health goes back a number of years, really prior to my engagement or Katie's engagement with the program. Title V funding has always been part of the local health department funding within the state of Maryland, and some of our local health departments in the past have used that funding to support their oral health programs. In addition, at one point in time, the office did receive Title V funds directly to help support funds and programs. During our Title V needs assessment, which was done throughout 2014 and into 2015, it became obvious that oral health, both for pregnant women and for children and adolescents, continues to be a priority issue within the state. We, within Maternal and Child Health Bureau, always knew that. Starting back from 2009, we had analyzed our own PRAMS data, which Katrina also referenced, to look to see whether or not pregnant women were receiving dental care. And our findings were consistent that insurance coverage tended to be the biggest issue in terms of pregnant women being allowed to access and really have available to them comprehensive oral health services. Maryland is lucky in terms that our Medicaid program does provide comprehensive dental services for pregnant women. However, those services end the day they give birth. So from one of the challenges that exists and really the growing partnership that has continued to exist between maternal and child health and oral health is to educate women prior to pregnancy as part of becoming a reproductive life plan. If you're planning to become pregnant, these are potential resources that will become available to you in terms of insurance. And then when a woman is found to be pregnant, whether in one of our Title X family planning clinics or when we're able to engage with women even in home visiting, is to continue to educate them that oral health is a covered service under Medicaid and helping them and assisting them in terms of accessing that dental care. We know that women who try to access dental care in their third trimester are less likely to complete treatment. And we know that women, and especially moms who have good oral health and value dental care, are often more likely to ensure that their children see that dentist by the age of 1. So really instilling those good habits early. Home visiting is a new partnership with us in oral health. The Maternal and Child Health Bureau has received funding since 2010 to implement evidence-based home visiting programs. And while every jurisdiction within the state of Maryland does have some level of home visiting, about 12 of them have an evidence-based home visiting program that's funded through federal dollar. And that program is specifically the one that we're working with oral health on to educate our home visitors and to really begin to bring that oral health message home, both for our pregnant women and our new moms, to ensure that children, toddlers, other people living in the house are able to access oral health services and know the importance and provide some of that basic education. We also continue to know that our Medicaid utilization for oral health services is low and continues to be low. The biggest barrier is inability to get an appointment. Often women don't find out they're pregnant until at the end of their first trimester, making those appointments even more difficult to schedule because often if you're a new patient, the wait time is significant. So we're really working towards that. We've continued to partner and are incredibly pleased to be part of the planning committee and group with the Perinatal and Infant Oral Health Quality Improvement Grant, as Katie likes to say, POKI, which allows us to hopefully move some more of this education forward to really begin to move women to accessing those oral health services, especially during pregnancy. So with that, I'll turn it over to you.
Thank you. Thank you, everyone. Elise, thank you for such a great overview. As Elise mentioned, we're partnering we're beginning to partner. We are one of 16 states throughout the country that are part of the POCI network working in this area. We just began our second year of this 4-year grant program. And so I'm going to get maybe a little bit more into the weeds, not too much into the weeds, but to provide just a quick overview of some of our POCI work. And if anyone wants to hear more or has any questions, please feel free to reach out to us. A key piece of our work is to really better understand barriers and facilitators to care during pregnancy. And so we're partnering with the University of Maryland College Park School of Public Health and the Center for Health Literacy. Dr. Alice Horowitz and her team have been conducting interviews of low-income pregnant women throughout the state in local WIC agencies. So this is really a partnership of our state WIC program, but also with numerous local WIC agencies to better understand these barriers and facilitators to oral health care during pregnancy. We're also providing surveys to these women to assess knowledge, understanding, opinions, and practices regarding the following areas: care, etiology, and prevention, the medical and dental care received during pregnancy. If the woman has gotten into care, we are asking questions about dental provider communication with the woman. We're assessing health literacy, and we're looking at social and family supports during pregnancy. And so this research is really going to continue to inform our current work, but also to inform our work into the future. In terms of OB providers, we are partnering to begin with,
Who's touching our slide?
that's okay, I'll
Go ahead,
keep going. Okay.
Yeah.
We're really using quality improvement methodology as part of our POCI work. So we're starting small with 2 FQHCs in Maryland, one right here in Baltimore City in an urban setting, and one in a rural setting on the eastern shore of Maryland. And we're partnering with the University of Maryland Baltimore School of Dentistry to train OBGYN providers in perinatal and infant oral health. In addition to training, we're also working together in partnership to explore ways to improve utilization of oral health care for pregnant women. And one of the models that we're real excited to sort of test the efficacy of and to learn more about its impact is a model of pairing an oral health screening appointment with a prenatal appointment. And so in one of these FQHCs, this is being done. It's a 30-minute dental screening appointment prior to the first prenatal visit. And in the other FQHC, it's actually part of the nurse intake visit, which happens many weeks. Sorry, guys, we're not sure what's happening with our slides.
Who's touching that?
So in the second FQHC we're working in, the dental screening is actually part of the nurse intake appointment, which happens a few weeks prior actually to the first prenatal visit. And so the purpose of that screening is to obviously look into the woman's mouth, but to also provide an opportunity to engage in discussion with her about the importance of oral health during pregnancy for both herself and for the future infant, to talk to her about the importance of oral health care during pregnancy and to assure her that care is safe. And probably the most important piece of this is the warm handoff from the dental provider after that screening to the receptionist to get her scheduled for a comprehensive exam and preventative care throughout pregnancy. And so that is really the key piece, is that warm handoff. And that is being tested right now in our co-located FQHC facilities where dental and OB services are delivered under one roof. We're also working together to talk about how oral health is integrated into prenatal care. Is it part of the electronic health record? Is it part of practice? If it is, what does that look like? Is it effective? If not, why? And if a woman does not have a dental home, is the OBGYN provider providing any kind of a formal referral and resources to her and that warm handoff and any follow-up to ensure that she got into care. Another key thing that we'll be doing here in the state is developing and disseminating state perinatal and infant oral health guidelines That's okay. And Katrina mentioned that as a key piece, and we're beginning to work on that, and that will be disseminated to all dental providers and OB providers throughout the state. Okay, Elise mentioned home visiting. We're really excited about this because this is a new partnership and certainly something that we feel can really make an impact in getting women into care. So we just completed a statewide presentation at a home visiting conference, over 150 home visitors. And now we're going to start working a little bit more closely with a few Healthy Family America programs to provide a little bit more in-depth training, but also to work together to discuss integration methods. How can oral health be part of the work that they're already doing, part of those weekly home visits, without it being too burdensome? And so we want to work together to discuss that so that it's something that's feasible and can be sustained into the future. We also are sharing resources. As Katrina mentioned, there's lots of good oral health resources out there, and we want to get them into the hands of home visitors. We're also looking to explore how oral health may be integrated into home visiting curricula in the state. Now I'm going to switch gears a little bit to our outreach to pregnant women. We have in the state a Healthy Teeth, Healthy Kids oral health literacy campaign, which is a plain language campaign, and we are expanding that to focus on oral health during pregnancy for Latinas. And so we're doing that. It's getting ready to start in the beginning of October, an 8-week radio campaign on a very popular Spanish language station in Maryland. We'll have a radio advertisement all about oral health during pregnancy, where there will be some interviews aired. There'll be Pandora, Facebook, and YouTube ads all about oral health care during pregnancy. And we're doing this in partnership actually with our state oral health coalition, the Maryland Dental Action Coalition. And I'm just going to show you, we have a new brochure as part of this campaign that is about oral health care during pregnancy. This is the front of it there. I'm going to flip to the inside. These are the campaign's 3 key messages: that dental care during pregnancy is important, both for the woman and for the future infant, that it's safe, and that in Maryland, if women have Medicaid, it is a covered service. And then there's some very basic tips to take care of the mouth there. Okay, I think that's it. If you have any questions or would like to hear more, please feel free to reach out to either myself or Elise. Thank you.